Hello and welcome. This is Health and Wellbeing. I am Lois Abasambu. Tuberculosis is said to be one of the deadliest infectious killer diseases, with about 432 people losing their lives each day. Although tuberculosis remains preventable and curable, it has remained a leading cause of death globally. Today on the program, we will be discussing about tuberculosis, its signs, symptoms, treatment, and control. Our guest today is the Director and Head of the Advocacy, Communication and Social Mobilization of the National Tuberculosis and Leprosy Control Program, Mrs. Itohowo. You're welcome to the program, ma'am.
Thank you so much.
And it's nice having you here.
Thank you.
Well, we're going to go on a short break, and when we return our discussion, we'll commence. Do stay with us.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we will realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite. This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television Star Times Channel 127, Free TV Channel 507, and UHF Channel 38.
Welcome back, and thank you for staying with us. If you're just joining us, this is Health and Wellbeing. And I told you that we will be discussing on tuberculosis, causes, symptoms, treatment, and how it can be controlled. And I told you that today in the studio, I have Mrs. Itohowo, who will be discussing this with me. So before we went on the break, Mrs. Uko, I said we're going to talk about tuberculosis. And now in layman's terms, you know, when we talk about tuberculosis, the first thing that comes to one's mind is coughing. But I'd like you to tell us in terms when we can and how we can understand what is tuberculosis.
Thank you so much. Tuberculosis is actually a disease that is caused by a bacterium. And the name of that bacterium is Mycobacterium tuberculosis. And it's a disease that is an airborne. It's airborne disease. And so what happens is when an individual that is infected with tuberculosis happens to cough or shout or sneeze, the droplets, normally when you sneeze, something comes out from your nose. When you cough, something comes out from you, even when you're talking.
Of course.
So the individual has been infected by the bacterium called Mycobacterium tuberculosis. When he coughs, that leper, the nuclei, comes out and hangs in the air. And because it's an airborne disease, it's carried, it's transmitted from one person to the other through the air. And so that nuclei hangs in the air, and another person comes around and breathes it in. And that goes into the lungs of the individual. And after some time, depending on the body immunity, the person ends up developing tuberculosis.
You said after some time, so it doesn't show
not
immediately.
immediately.
How long does it take before one begins to show signs and symptoms of tuberculosis?
1 month, 2 months, depends on the body immunity of the individual. You know, we have immunity that fights infections that comes in. So depending on the individual's body immunity, it can stay for 1 month, it can stay for 2. So it depends. There is no fixed duration.
Okay.
Yeah.
So now, what are
But
the
at least
general
between 1 to 2 months
it should
incubation period.
begin to show? Okay. So what are the general signs and symptoms that one would see to know that, okay, these are signs and symptoms of tuberculosis, I should go get checked?
Okay, you've talked about the cough.
Yes.
Cough is generally is cough, but you also have the loss of weight. The person will lose weight. Not even when you're making effort. Sorry, even when you're making effort to gain weight, you see yourself losing weight uncontrollably, undesired loss of weight. And then you also have the person sweating excessively, especially in the night, while others even though the weather might be hot, others are sweating, but your own
because the weather is hot
drenching,
now.
so we call it drenching kind of sweating, that your pillowcase might end up getting soaked, your nightgown if you're a lady, or your pajamas. So there is that excessive sweating. I've talked about the cough. We have talked about the loss of weight. I've talked about excessive sweating, and then also fatigue, and then loss of appetite. No, rather maybe different types of tuberculosis that we wanted to say.
Okay.
Like the tuberculosis of the lungs, which is the most commonest one.
Okay.
You have the one that affects the lungs, which is very common. And that is the one that, like I said, is airborne. And then you also have the one that can affect other parts of the body. Extrapulmonary tuberculosis can affect either the spine, can affect the abdomen, can affect even the neck, and all other parts. So those are the various types of tuberculosis that you have.
Now, bringing this, it's enlightening because you let us know that it's not just about the lungs. There are other parts of the body as well.
We call it extrapulmonary tuberculosis.
Yes. These types of tuberculosis, how are they contracted? Is it also the same way that you would contract the tuberculosis of the lungs? Now, when you say that it affects, some affects the skin, some affects the spine, and all of that.
Yes, you still by through breathing in, but like I said, you have now depends on where the part of the body where it now resides.
Oh, okay. So it depends on where it resides.
Yes,
okay,
it affects.
Okay.
Yes,
okay,
yes.
Okay. So, but is there a difference between these different types of tuberculosis, or it's just dependent on where it affects, and that's all?
It actually depends on where it's affected. Yes. And also the mode of diagnosis is also different.
Okay, so what are the different modes of diagnosis?
For the one that affects the lungs, the sample that will be required for testing is mainly sputum. Sputum.
Yes.
Because it is from the lungs that you can bring out sputum. It could also use stool for children that might not be able to produce sputum. But for other extrapulmonary other parts of the body, it might end up having to get the fluid from the areas where it is affected, like the spinal cord. You might need to have the spinal fluid to be able to diagnose. Yes.
Now, we spoke about ways of transmission, and we spoke about that it's airborne, and so if someone that already has tuberculosis coughs or sneezes and then releases these things into the air, people actually get it. But I would like to find out what is like the main cause of tuberculosis.
It's caused by a bacterium.
Okay.
And the bacterium is called Mycobacterium tuberculosis. Yes.
Oh, okay. Yeah. So now let's talk about treatment of tuberculosis.
Okay.
What are the ways in which we can treat tuberculosis?
First of all, the individual needs to be diagnosed, and we have various technologies for diagnosis. We have what is called the gene expert machine, which is we have up to 507 in the country. But that is not enough because it's expected that at least one gene expert machine should be located in an LG. You have seven
174.
774
Yes.
LGS. So as at now, we have at close to 507 gene extract machine. So that is one of the technologies that is being used to diagnose the TB. We also have what is called the Tronat machine, which is the point of care device. We have the X-ray that is used for children that, like I said, children that might not be able to produce sputum. So you use the X-ray to examine their lungs, to be able to see if the child has tuberculosis or not. It can also be used for the adults also. Then we have the TB lamp, where an individual cannot produce sputum or there is no X-ray, you can actually use urine to test. So those are the various methods and more that can use to diagnose tuberculosis. And when one is found to have tuberculosis, we have medications that can be used to treat this. We have the one that is a 6-month course, and that is for tuberculosis that we call the susceptible drug susceptible tuberculosis. The duration is 6 months, and where an individual defaults, most cases, in following up with in adhering to the regimens of might end up having what is called the drug-resistant tuberculosis.
Oh.
Yeah.
So
but they have various regimens and different types of drugs, combinations of drugs to use in treating them.
So now you spoke about people failing to be able to follow up, adhere.
Yes.
How many times would you have failed for them to say that, okay, you have not adhered? Because sometimes, somehow, the way life just gets so busy, sometimes people just forget. Would it take for like a week or 2 weeks? Or if you just miss one day, then you're at that point where maybe your tuberculosis is becoming drug resistant?
No, ma'am. Maybe if continuously you stay away from taking the drugs for about 3 weeks to 1 month, there's tendency of developing the resistance is there.
Now, it's very scary because, when you have an illness that is now resistant to a drug or medication, it's almost like now there is no medication that can tackle this disease. Now, if a person gets to the point where his tuberculosis is drug resistant, is there a way out for the person?
There's a way out, because it would now requires longer period of treatment and stronger medications to more combinations of the drugs. Whereas if the person had kept to the regimen for a drug-resistant tuberculosis, which is just 6 months, after 6 months the person gets cured and gets back his life.
Okay, so now talking about getting cured and getting back your life, and just what I've said, that there are different regimens of treatment and that people can actually take on. But is it possible that after someone is treated, take for example, you took your medication 6 months and you were done, is it possible for you to still get reinfected?
Yes, you could.
Okay.
They could, but it's not very common. But you can still get reinfected. Yeah.
Because most especially
so that is why even with the treatment, you still need to prevent. Prevention, they say, is better than cure. So preventive measures needs to be adhered to.
Okay.
Yeah.
So now that you've taken us to preventive measures, let's just talk about preventive measures. What are the ways people can actually prevent tuberculosis? One
is avoid staying in a crowded area. Avoid staying in houses where you have poor ventilation. We've said that tuberculosis is an airborne disease.
Yes.
So if you stay in a congested place, or you stay in a place where the airflow is not very good, airtight, it's an airtight place. Like I said, the microbacterial nuclei hangs in the air. But if it's a place where the wind blows, it will be blown away. When the current is not very strong, it stays there. And if somebody comes around and inhales the nuclei into the system, it start developing. So overcrowding should be avoided. Poor ventilated residents should also be avoided. Should also be avoided. Then we should also avoid spitting in public indiscriminated, just spitting anyhow. Then we should, like, thank God for COVID-19. We should always cover our use our nose mask and eat well too, because if, like I said, even the body immunity is also very important. So even when the individual happens to breathe in, if the body
Immunity.
fighters are able to fight, it will suppress. Yes.
Okay. So now just talking about prevention and also talking about people getting to get treated. And because, like I said, like you said earlier, sorry, the most common form of tuberculosis is the one that we know that actually affects the lungs.
Yeah.
Yes, and people can actually get treated, and it's curable anyways, even though it's also a leading cause of death. Is it possible that even after you've been treated, that because of, take for example, for people that have had prolonged cases, is it possible that even after you've been treated, a part or maybe your lung would still maybe be damaged in one way or the other?
Like in any other disease, early diagnosis is very key. So if you are diagnosed early and placed on treatment and you adhere to treatment, the tendency of getting your lungs damaged is very slim. But if you've allowed, rather than going to where you will get appropriate treatment, keep going from one place to the other and taking medications that are not even meant for the treatment of tuberculosis,
Yes.
and it might end up eating up the lungs, affecting the lungs. So even though you'll be healed, but if the lungs had been in one way or the other damaged, it would also take some time for it to heal. Yeah.
Okay. Well, we're going to go on a short break, and when we return, we're going to talk about what you have been doing, or what Nigeria has been doing in making sure that tuberculosis is prevented and the spread of tuberculosis is ended in the country. Do stay with us, and when we come back, our discussion will continue.
Okay.
Following the sudden outbreak of cholera in some parts of the Federal Capital Territory, significant number of cases have been tested positive for cholera. The Health and Human Services Secretariat has intensified surveillance in the affected communities around the area council. Therefore, residents are requested to report any case of diarrhea to the nearest health facility or the Department of Public Health on the following numbers: Dr. Sadiq Abdurrahman, 0803 705 1784, or Dr. Doris John, 0803-315-6560. Ensure that the water used for domestic purpose is clean, boiled and filtered. Start ORS immediately you have diarrhea. Ensure that all food is properly cleaned and well cooked before consumption. Ensure that fecal waste are hygienically disposed of. Do not defecate in the open or into streams. Houses with surface wells should make sure they are covered all the time. Public Health Department, FCT Health and Human Services Secretariat. Announcer.
Welcome back, and thank you for staying with us. And this is still Health and Wellbeing, and we've been discussing tuberculosis, causes, prevention, and treatment. Before we went on the break, I said we're going to talk about what Nigeria is doing to end tuberculosis and save lives. Now, in view of this year's World TB Day, which is Invest to End TB, Save Lives, what is Nigeria doing? What are the steps and measures Nigeria is putting in place to make sure that we're able to achieve this, we're able to end tuberculosis, we're able to reduce, if possible, even end the spread and transmission of tuberculosis?
As a country, we've been doing a lot to aim at ending tuberculosis as a nation. In short, the whole world is looking at Nigeria, waiting for Nigeria and all other. I must say here that Nigeria happens to be one of the 30 high-burden countries in the world. Yes. And so the whole world is looking at the 30 countries with very high burden of tuberculosis to end tuberculosis in their various countries. And Nigeria, as one of the countries, is also doing a lot. I've talked about putting the mechanism in place. As a country, we have the diagnostic tools that are in our facilities.
Yeah.
We have also expanded the DOT centers almost in every community or closed most LGS. You have the DOT facilities. DOT facilities are those the centers where the TB patients have been taken care of. The drugs are being given. So we have the gene expert machine that are meant to actually diagnose anybody that is suspected to have tuberculosis. Remember, I said a cough that had lasted for 2 weeks or more should be tested for tuberculosis. And so they have also have trained health workers in all the facilities who take care of the patients. We have X-ray machines that are meant to also use to diagnose children that are suspected to have tuberculosis. And above all, with support from partners, we have drugs that are there waiting for people in the health facilities. I must say here that both the diagnosis and the treatment of tuberculosis in Nigeria are free. So once anybody has a cough that had lasted or suspect to have tuberculosis, there's no point going around looking for what to do or where to go to. It's better the person goes to the health facilities where the person can be treated, can be diagnosed appropriately, and then placed on treatment. We've also been creating awareness. I'm sure you were part of the workshop we had, because we know that knowledge is power. And we also know as a program that currently people are not very aware of the fact that we still have so much tuberculosis in our communities. So we've also, as a program, decided to engage the media, create awareness in our communities, engage the CBOs, the community-based organizations, and the civil society to actually create awareness at that level, where we know that is where we have much of the burden of the tuberculosis residing. And we also have trained, like I said, we also have training centers where health workers can be trained at Zaria. We have a TB training center at Zaria, where all cadre of the health workers are being trained to be able to render the services that are being needed to the people. The government is also putting a lot of money, some money at least, to ensure that we employ qualified staff to handle the services from the national up to the subnational up to the local government areas. Yeah.
Now you said something. You said diagnosis and treatment is free. Is it just in public hospitals or even in private hospitals? Because some people don't really get this so straight.
Yes, some of not in all private, but some of the private hospitals that we've engaged, but in all government hospitals, they are free.
Okay.
Yeah.
Okay. So now, as the director and the head of Advocacy, Communication and Social Mobilization of National Tuberculosis and Leprosy Control Program, I know you go on the field quite often and you see a lot of these cases, a lot of situations like this, and that actually shows that there's still room for improvement, despite everything that has been put in place. But we still see that we're still on this journey on ending tuberculosis. In what ways do you think the strategies and the programs can be improved to make sure that at least this moves faster a little bit?
One of the drivers of tuberculosis in Nigeria is actually like I said, the low awareness. And the low awareness has also made so many people to have misconceptions about tuberculosis. If most cases at the community level, people see tuberculosis as a disease that is caused as a cause from God. a lot of misconceptions are there at the community regarding tuberculosis. Some see it as a punishment, some see it as the result of your sin, and all kind, or some as things, very weird things that you wouldn't want to talk about. And so, because of that, people don't own up to have tuberculosis.
Yes.
Rather than coming out to be tested for if they suspect they have tuberculosis, they rather go to other places where they think they can actually get help. And you know, if you have tuberculosis and you take other things that are not anti-tuberculosis treatments, there's no way you'll be cured.
Yeah.
And so the low awareness, misconception, discrimination, stigmatization at the community level, even among health workers. You see, when we go to, like, talk about going to the field, you see in the health facility, the other hospital staff that are not working in the TB section,
yes.
trying to discriminate or stigmatize this other one. They don't want to come close because to them they don't want to have tuberculosis. And also, people also believe that if you interact with somebody that has tuberculosis, it's an automatic thing that you'll be infected, which is not true. Yes, it's not. You see people discriminating up to using cups. They don't use. They don't want to use this person's cup because this person has tuberculosis. But you cannot get tuberculosis through drinking from the same cup. It is only
because
through the air.
I would think that because you have saliva in your mouth, and then if we share a cup, there's almost like an exchange of saliva in the mouth. Doesn't it work that way?
When you breathe in, is through your lungs. The one you drink is into your
stomach. Okay. Okay. But also talking about being very close. You know, sometimes, and just like you said, we may be speaking and you may not see things falling out. No, I'm not trying to justify stigmatization anyways. In no way is that right anyways. But I feel that that would kind of be like preventative measures where if you're actually if you actually have tuberculosis, at least there should be kind of isolation, maybe till you're being able to be treated. Because it stays in the air. If we're here together and you speak, sometimes things fall out of our mouth and we don't even see them. And because, like you said, they're nuclear, they're very small, we don't see it. Is that wrong in any way to see that if somebody has tuberculosis, this person should be isolated for an amount of time?
It was thought that once somebody that has tuberculosis is placed on treatment, after 1 month to 2, the mycobacterium in the body of that person is inactive. He or she can no more infect the other person.
No, but in this period before it gets to that time,
yes. But we've talked about avoiding overcrowding, avoiding congested areas, or poorly ventilated area. Yes, that distance should be given. Meanwhile, there's that sometimes people go beyond just giving the distance to making this other person feel less than a human being because the person has tuberculosis.
Oh, okay. Now that actually does clarify it, and I'm happy that you've done that because so that people understand that, okay, even if you're asked to be isolated or if I'm giving you some space, it's not because I'm discriminating against you, but it's just so that at least we prevent it from, or prevent other people from getting this and all of that. But before we wrap it up on the program, I would like you to actually give a word of advice to people out there concerning tuberculosis, what they should know, how they should take care of themselves, and make sure that at least they're able to prevent tuberculosis.
Okay, thank you so much. Like I said, tuberculosis is like any other disease. And so anyone that has cough that had lasted for 2 weeks or more, or is losing weight, or you've lost appetite, or you're sweating excessively in the night, I would advise that such an individual will go out and do a test. And like I said, test is free, and the drugs are also free. Actually, the drugs are there in the health facilities waiting for people to come. We'll be happier to see people go and take these drugs rather than allowing them to stay and expire. And so discrimination should also be played down. so that people can actually own up and come out to do tests. You know, when HIV came newly,
Yes.
that discrimination was also there, stigmatization was also there, and people rather went underground.
Yes.
But when the media, like you guys, took it upon yourself to sensitize the people, create the awareness, and a time came that people were able to actually come up and say, no, rather than staying to die, they own up to have tobacco, to own up to have HIV/AIDS, and because the drugs were there free, they were able to access the drugs, and they were able to also at least stay longer. Unlike HIV, that the cure in quote might not be there for now. For tuberculosis is curable and is also treatable, and so no one has the right to stay and die because of tuberculosis, when you know that it can actually be cured, and you have the treatment that are given to the individual free of charge.
And I just remembered, 2020 to 2021, the biggest thing that happened in the world was COVID, and also had some symptoms similar to tuberculosis. Did the tuberculosis and leprosy control program, did you experience a, how do I want to put it now, a low in number of people coming, and why was that?
Why? Because the protocol for COVID was that if you suspect to have cough, COVID, if you have cough and you suspect to have COVID, you should
Isolate
yourself, stay for about 2 weeks alone from others. Whereas the protocol for TB is that if you suspect to have tuberculosis, you have cough, and you're suspecting to have tuberculosis, go to the health facility and be tested.
Yeah.
So that confusion was there. But thank God we were able to move around it, working with the NCDC people. We were able to develop some messages that made people to know that not every cough that is
COVID.
That COVID.
And because of the stigma of COVID as well.
And also we also be able to differentiate the symptoms of COVID-19 from that of the tuberculosis. For COVID-19, yes, your cough will be dry. Your temperature will be very high. And whereas for tuberculosis, your cough will be wet. That's you will be able to cough and bring out sputum. Yes. And then your temperature, you have very mild temperature. Yes, the body fatigue were the same, but there were other things that actually were able to differentiate the symptoms of COVID-19 from that of the tuberculosis. Yeah. And with that, even the health workers too were also afraid to treat people with cough.
Any kind of cough. Because I remember the program, there was one of these programs during COVID, it was like, check that cough because it may not be COVID, And at that point, I would think that there were quite a number of people that had tuberculosis but did not even come out for treatment because of the fear of being diagnosed with COVID. And almost everybody was scared of being diagnosed with COVID. Even people that had symptoms will refuse to go to be checked because they didn't want to be diagnosed.
And even when they got to the facility and they asked during the vital sign taking, do you have cough? Even when they have cough, they will say no. But I want to say here that in case anyone has doubt as what to do if you have a cough or have all these symptoms I've mentioned, we have a toll-free number that somebody can actually call free of charge to get more information and also to get direction as per where to go to do the test, and which is 3340.
3340.
Yes,
so that's a
yes.
toll-free phone number that you can call to find out if you have tuberculosis or to find out anything you need actually about tuberculosis.
Yes.
So thank you very much, Mrs. Oko, for taking our time to be here with us on health and well-being.
Thank you so much.
Thank you so much.
Thank you.
Well, that's the size of our package today, but remember that prevention is the key to stopping the transmission of TB. Therefore, regularly check yourself and also check that cough. Keep it to date with us, same time next week. I am Lois Apasambo. Do stay safe.